Hi, I'm Kira, a transgender woman and psychologist who shares my experience of transitioning from male to female. 6 months ago, I had my facial feminization surgery in the end of July 2024. Most of the swelling has already gone, so now I'm sharing my results. In the end of this video, I will also leave some tips on how to prepare for the surgery and for the fast recovery. I've scheduled my surgery 2.5 months before the actual procedure, and it was a pretty hard time of anticipation. After the surgery, I've stayed for 1 day in the hospital, and the next day I went to the hotel. In 2 weeks, I flew back home. I shared a detailed story of my recovery in one of my previous videos. I will also leave the link in the description below. I had most of the procedures done on the upper and middle part of my face. It was type 3 forehead recontouring, brow bone shaving, also cat eyes procedure, brow lifting, lipofilling of my upper and lower lip, and also stem cells injections. This is the last video I've recorded a night before the surgery, so you can compare how I looked before and how I look now. Hi, I guess it's one of my last videos when you can see exactly this face. Tomorrow I'm going to have facial feminization surgery in Turkey, in Antalya. So I'm pretty excited about it. Let's see what will happen. Am I happy with the result? I would say mostly yes, probably 70%. What helped me the most is cat eyes procedure and brow lifting. Before the surgery, I had straight and low-sitting brows. By lifting them, I got this curved shape, and also they don't hang above my eyes that much. Also, before the surgery, my eyes looked like they're semi-closed. Now they're more visible. I'm also pretty happy with the result on my nose. It got thinner, and I got this little curve. But I guess I will need another rhinoplasty to reduce the width of the nostrils and the size of my nose tip. In my case, this surgery should have been done in 2 stages. Talking about the forehead recontouring, I have mixed feelings. Before the surgery, I had very prominent brow bone. And yes, this surgery helped to some extent. Mostly it's visible from the side, but you still can see it. In my case, this surgery should have been done in a more aggressive way, so more of the brow bone should have been shaved. I had some complications with recovery after forehead recontouring, since the air was leaking through my sinus bone when I was blowing my nose and sneezing, and the problem isn't completely solved yet. I blew my nose, and then I figured out that my forehead skin is inflating from the inside. Immediately I contacted my surgeon and told him about it, and he replied that it is a pretty common thing to happen. Since I had a forehead recontouring procedure done, he removed part of my sinus bone over here, he shaved it, and then put back in place. But there may be some air leakage during the first 2 months of recovering. So for 2 months he restricted me blowing my nose and sneezing. So I guess I will need another forehead recontouring in the future. I also had some complications with the recovery of my right brow, since it was numb and completely paralyzed. I couldn't move it and I couldn't feel anything. Now it's getting a little bit better. I can move it. But sensation, no, it's not there yet. Regarding sensation on my face, I've lost some feeling some parts of my forehead. For example, here and here. I can barely feel it. The same goes to the tip of my nose. I can feel some pressure, but the healing process goes pretty slow. The most debatable part for me is lipofilling of my upper and lower lip. The result was visible maybe for 2 or 3 months. Yes, I can still feel some volume, but there is no much big difference between before and after. I can't say anything about the stem cell cocktail injections. Yes, there are definitely some effects of the HRT because my face became less angular and I gained some volume in my cheeks. Wrinkles under my eyes became less visible after cat eyes procedure. I also started using tretinoin, which produces collagen. It reduces the pore size and reduces micro wrinkles. Was it worth it? Definitely yes. Will I have another FFS? Probably yes, in the future. I want to do some other procedures, and I'm not fully satisfied with the ones that I had. In general, I'm very happy that I had FFS, despite all the complications. It significantly boosted my self-esteem. I'm not anxious anymore of being clocked when I'm going out somewhere. But the best part, it helped me with fighting gender dysphoria. I love my reflection in the mirror. Now here are some tips that will definitely come in handy during your first recovery period. If you have any chance to take someone with you, just do it. If no, then prepare yourself and your apartment for a couple of tough days on your own. Buy some soft food like soups or puddings and portion them into separate disposable containers. Get plenty of water. Small bottles work best. And also buy some straws for drinking. Charge all of your gadgets and upload some audiobooks and music. Also turn off your Face ID and fingerprint scan, because you will have a hard time using it. Also activate Siri or Google Voice Assistant to help you. Make sure you have an elevator or live on the ground floor, because going upstairs with your swollen and almost closed eyes can be a tricky thing to do. Explore your apartment and your room. Try to memorize where everything is located. Buy plenty of soft tissues or cotton pads. You will need a lot of them. Wear a bathrobe or something comfortable, so you will easily take it off or put it on. But the most important part is always bear in mind that you will get better. You can feel scared, lonely, frustrated, or anxious. You can feel that you are stuck in this state forever. But every single day brings new improvements. The healing process goes pretty fast, so don't let any negative thoughts or emotions slow it down. Unrealistic expectations are the worst enemies of any gender-affirming surgery. We jump through a lot of hoops, we spend a lot of money, endure pain, and during the long recovery process, we're being immobilized. It's obvious why people think the surgery will change their lives overnight, or completely erase gender dysphoria. Unfortunately, that's far from reality. There's no magic wand that will instantly transform your life. This surgery gives you new options, removes some roadblocks on your journey, and gives some new tools to change your life. Talking specifically about FFS, it helps you by giving more feminine facial features. You spend less time on applying makeup. You're less anxious about being cloaked while going publicly, and you easily present as a woman. But it won't fix your posture, your clothing style, your 5 o'clock shadow or voice. FFS alone won't change everything, but it will help you to some degree. Another point about unrealistic expectations is about our anatomy. We'll have our own weights, heights, proportions, and surgeons aren't magicians. They can't change everything, and they have to work with the base that we gave them. Listen to your surgeon's advice carefully. They study anatomy, and they know what realistically can be achieved. Of course, you should show them your dream image and ask whether it will suit you. For example, in my case, I wanted a tiny nose with a raised tip. I've asked my surgeon about it, and he replied that considering my height, people looking up at me will see 2 big holes in nostrils. You have to trust your surgeon's expertise. The third point about unrealistic expectations is about the recovery period. The first 80% of bruising and swelling go during initial period of recovery. It lasts for approximately 2 months. But the remaining 20%, they go during 6-12 months. During this period, you can't judge about the final result or decide whether you need a revision surgery. So give your body some time to heal fully. Before the surgery, I felt anxiety. I thought about complications, about the pain, about recovery period, about finances, about changing photo in my ID, and also about whether my closest people will recognize me. It's normal to feel scared and anxious. Before the surgery, I spent a lot of time reading reviews and talking to other patients. I was lucky to find a woman on Reddit. She had her FFS done with the same surgeon a couple of months before. She was kind to share her experience in details with me without any sugarcoating. So I knew what to expect from the recovery and the final result in this clinic. For instance, she told me that most likely I will have a lot of swelling and bruising and will be almost blind after the cat eyes procedure for a couple of days. And guess what? That's exactly what happened to me.
Copy planes. Yes, yeah, plane. Copy planes.
I also asked my surgeon countless questions, even some silly ones. But I had full understanding of the procedures that I will have. I had complete trust in my surgeon and his team. That's why when I woke up from anesthesia with a severe pain in my back, completely blind, and suffering from nausea, I stayed calm. I knew that surgeon and his team will take care of me. I followed their instructions. Drink water, sleep, sit in the wheelchair, and give your hand for the IV. Frankly, it's the only that you are capable of during your day one after the surgery. I had been jogging for several months. A couple of weeks before the surgery, I increased intensity of my trainings, because I knew that during the first recovery period, I will not be so active. What I did wrong, though, was neglect my sleep schedule. I was overworking. I had only a couple of hours of sleep time before the surgery. I tried to finish all of my work beforehand. This was a big mistake. I couldn't sleep properly for several days post-surgery. I woke up every hour trying to find the most comfortable position for me. Considering my previous lack of sleep, it was exhausting. Nutrition, activity, and sleep are the most important things for the fast recovery and healing. The process doesn't start when you're on the surgical table. It begins a couple of weeks before. Bring your body and mind in the best possible state beforehand. Stress hormones like cortisol interfere with the body's ability to heal. So avoid any conflicts and stress until you are fully healed. My surgeon also recommended avoiding caffeine, which was pretty tough for me as a coffee lover. It included black tea, matcha, and chocolate. So no fun for at least 2 weeks before and after the surgery. He also recommended against red-colored fruits, spicy, and fried food. The hardest part for me was adjusting my HRT regimen. I had to stop taking spironolactone, my anti-androgen, a week before and after the surgery, because it thins blood and can be dangerous. Personally, I felt terrible without it. Anxiety and dysphoria hit very hard. I noticed increase in my body hair growth. And also I felt aggression. Thankfully, I wasn't forced to stop taking estradiol, as it could have been even worse. If you find value in my content, want to support my work, or just say thank you, please consider donating to me on buymeacoffee.com. It's a small way to help me continue creating these videos and covering the costs involved. You will find the link in the description below. Thank you for being with me. Please subscribe, hit the like button, and see you soon in my next video. Bye.